little bit about myself first. I work at Intermountain Health in what used to be headquartered and based in Salt Lake City, but we actually just merged with Sisters of Charity Leavenworth. So we went from a 25 hospital system to a 33 hospital system. So I've got hospitals in Colorado, Utah, Idaho, Montana. I've got clinics in Las Vegas, in Wyoming. We also purchased an organization called Classic Air. So we have 98 aircraft actually across the country. I've got one in Puerto Rico, and I had lots of volunteers to go there and inventory the equipment if we wanted, but we didn't send them, and as well as in Alaska. We're continually growing. We just opened our newest children's hospital in Lehi, Utah. We've got one in Salt Lake, and we'll be expanding beyond that as well. I've been there. What's that? Yes, yes. We've got rotary and fixed wing, and then we also have a jet that's used for organ transplant. So we'll fly individuals to different states or from different states to our organizations or to other organizations that they need to go to. So it's an impressive operation. I've got a couple of guys that specialize in the aircraft, in the medical equipment on the aircraft. One of them actually on our jet, they were getting it rigged up because we had a patient that was at our primary children's hospital, pediatric patient, they wanted to transport over to Germany. And when he was setting the equipment up to make the transport, and they were concerned about the equipment. So they said, you're going with to Germany to make sure this equipment operates all the way over. And so he was pretty excited about that. But yeah, we've got the only clinical caregivers that are certified in high altitude rescue. And so we've got nurses and others that drop from the helicopter down into the canyons to rescue people and bring them out. So, and I know the capital planning, when they were talking about capital planning and selling equipment and stuff, we just sold a helicopter for $3.5 million. So it's kind of cool when you can sell a piece of equipment and get that much money for it. But anyways, if you've got any questions as we go through this with strategic plans, feel free to jump in and ask. You don't have to wait till the end, and we'll get through this and make sure that we get everybody out so you can go to the party. So purpose and objectives. Our strategy is develop a strategy. We'll talk a little bit about strategic planning versus operational planning. Why create a strategic plan for the HTM department? Where do we start? What are the critical elements? We'll bring it all together and how to communicate the plan, as well as reviewing and evaluating the effectiveness of the strategic plan. So strategic plan versus operational plans, it's really comes down to a lot of the items that are listed here, and it's the time period. So when you look at a strategic plan versus operational, operational is going to be more of a compact time frame. So you're going to look at, you're going to look at that time frame from an operational standpoint that may be a year long, maybe 6 months long. And then the strategic plan is going to be over a long term. And I know that prior to COVID, we were looking at 3 to 5 year plans. And now, because of some of the delays and the things that occurred during that time frame, we're actually looking at 5 to 7 years now with strategic plans. The modifications, again, occasional modifications versus a monthly evaluation. So your operational plan, you're going to look at every month. And modify as things change within your department or within your organization. And a strategic plan, longer term, so you're going to look at it less. That doesn't mean put it up on the shelf and let it gather dust and never look at it again. But it's going to be, you're not going to look at it as often. The goals, again, the strategic plan is going to be long-term. Where are we going to be in the future? How do we position ourselves for the future? And it's really broad in scope versus the operational plan, which is going to be a lot more narrow and a lot more focused. The plan generation, high-level leadership versus local teams. So with my organization, I have 6 area directors that have multiple facility responsibility with geographic areas. So we have a strategic plan on where we want to take HTM or clinical engineering. We have that strategic plan where we want to go as an enterprise, and then each one of my area directors has a piece of that on how they want to run their business and where they want to be as we move into the future. Now they have their operational plans that they're measuring every day, every week, and they've got dashboards that they're looking at. And then again, they contribute to, so they come together. I bring them together every year for a retreat in the fall that we look at that strategic plan. Where are we at? How are we doing? What can we do better? What modifications need to be made? Budget, again, the annual operating budget is going to be associated with the operational plan. Strategic plan, anything that from a financial perspective on a strategic plan is going to be specific to those items and to that strategic plan. You know, as we look at it and say, okay, 3 years from now, we're going to be doing all of our linear accelerators in-house. What's the financial requirements that are going to come along with that? We need to hire staff. We need test equipment. You know, what do we need as we continue to bring that, as we look at that strategic plan and bring it in? It's going to be specific to those items. The reporting, again, the monthly operational reports are going to go to individuals that are local, and the strategic plan is going to be a much higher within the organization and the reporting. And again, the focus, distinguish the difference. It's, you know, what are we doing better? What do we need to go? Where do we need to go as a department? And how do we contribute within the organization? So why create a strategic plan? So a little quiz here. Neither Redbox nor Netflix are even on the radar screen in terms of competition. It's more Walmart and Apple. You know who said that? Anybody? What's that? Former Blockbuster CEO Jim Keyes in 2008. His video rental chain filed for bankruptcy in 2010. And today Netflix is worth $61.93 billion. Do you know that he had the opportunity to buy Netflix when he made that statement? He had the opportunity to buy them for millions, and now they're worth billions. $500 fully subsidized with a plan, that's the most expensive phone in the world, and it doesn't appeal to business customers because it doesn't have a keyboard, which makes it not a very good email machine. Former Microsoft CEO Steve Ballmer, those were his comments on the first iPhone. There is no reason anyone would want a computer in their home. Ken Olsen, founder of Digital Equipment Corp in 1977. Do you think these guys had good strategic plans? Do you think they were looking to the future? Screw the Nano. What the hell does the Nano do? Who listens to 1,000 songs? Motorola CEO Ed Zander about the Apple's iPod Nano in 2006. Interesting, isn't it, that you look at these CEOs and they didn't position themselves for the future. They weren't looking to the future. They were looking at the now. I mean, how many Blockbuster stores do you see out there now? Zero, none, they're gone. But yet he had the opportunity from a strategic standpoint to position his organization for the future, but he Redbox nor Netflix. So why create a strategic plan? Look to the future. Know what's going on in the future. I'd ask this, I've talked to some others that, you know, artificial intelligence is here. It's here. It's been here for a while, and it's only going to get stronger. And when I talk to some individuals, they say, well, medical technology, medical equipment, it's not good. That's not relevant. And I said, how long have we had programs in place that monitor CT scanners that gather data and information, and then they pop up and say, hey, based on the information I'm looking at, the CT tube's going to fail sometime in the next month. You need to replace it now. Don't wait for it to go down. It's been around for a long time. Artificial intelligence. I think that into the future, medical equipment at some point, I think medical equipment is going to generate their own work orders. They're going to say, hey, based on my behavior and what's going on, I've got a problem. And I've already rebooted myself, and that didn't fix it. And based upon the information I've gathered, here's what I think is going wrong with me. And then it's going to, through the network, it's going to generate a work request that goes right into the CMMS and is dispatched out. Am I way off base? I think if you look at technology as it continues to develop, that's what we're going to start seeing. We're going to start seeing a lot of those things. So we got to look to the future and make sure that we stay relevant within our own industry, within our own departments, and that our organizations are staying relevant, because we have a tremendous amount of input into that as well. So why create a strategic plan for HTM? If you fail to plan, you plan to fail. So it really sets a direction for the department. Not just when we talk about the operational planning, we're talking about that, you know, the goals and objectives that we set and the things that we measure on a daily basis, and we look at every day, we look at every week, we set every year, where the strategic plan really sets that direction to the future. How are we going to be relevant? As technology advances, how do we handle that? How do we stay on top of things? What tools and resources are we going to need to be able to do that? Goal alignment, it really drives standardization of activities and initiatives. The allocation of resources, when you look at the resources that are required, what are they today in comparison to what we're going to need in 5 years? You know, there's a lot of talk that has been going on for years about our aging workforce, even in our industry. I mean, I have 172 FTEs in my department, and 40% of them are retirement eligible within the next 5 years. 40%. That number jumps to like 70% or 80% when you look at 10 years. Risk management, really identifying the potential risk. What are the mitigation strategies? So what are the risks as we move forward? What are we going to put in place to mitigate those or reduce the risk, not only for our department, but for the organization as well? We talk about retirement. Carol just came in and she's never retiring. If you don't know Carol, you need to, because she's fantastic, got a lot of knowledge. Also, measuring performance, it really gives you a list of key performance indicators that you can look at from the strategic plan for routine assessment. So you can take a look at that and say, how are we performing? What are we doing from a departmental standpoint? What is our performance looking like? What is our, and that's from a productivity standpoint. It could be from a cost standpoint, a number of different things that we look at. And, and really it helps us make decisions. It could help us gain an advantage. And really, it ensures that we're communicating with the organization that we are in alignment with what they're doing, and that we're aligning with their path to the future, and we're part of that process. We don't want to be next, because you can see, if you look up there, how many of them are still around. You know, when's the last time you seen a Radio Shack or a Toys R Us? Carol, it's in Macy's. I thought Carol was going to say she owned one, but Circuit City. I mean, look at some of those that are up there. It's like they were really big players in the market not too long ago. So where to start? Organization overview. So mission, vision, and values. And this is one thing that I always talk about, or that I bring up anytime that I do a presentation. And I know there's some that disagree with me, but I am a firm believer that I always ask everybody, I said, do you have a mission statement? Do you have a mission statement in your department? And if you do, is it different than the organization's? Because if it is, take it off the wall, tear it up, and throw it in the garbage. Your mission statement should not be any different than the organization's. Your mission statement, now the vision and values, you can align with those, but the mission statement should be no different. And if you go to my departments right now and you walk in and you ask any one of my staff members, at least I hope this would happen, but if you walk in and you say, what is our mission statement? They'll tell you the organization's mission statement, and then they'll tell you how what they do relates to it. So they know the tie-in. And from a leadership perspective, that's our job. If our staff, if our caregivers don't know how their job aligns with the organization's mission, we're failing as leaders, because they really, really should know that. And I know I've had people before say, well, you can have a different mission statement, and you can if you want. I mean, it's not mandatory or whatever, but I have a firm belief that every mission statement in every department in the facility should match the organization's. Now the vision, you can have a different vision, but it should be aligned with the organization, as well as the core values, because they drive really the decisions and the behavior of your staff and your department. So we need to align with the core values of the organization, and we need to align with that vision. At Intermountain Health, our shared vision is we are dedicated to the mission of helping people live the healthiest lives possible. So now it's up to me to say, how does our department align with that mission? How are we helping the organization achieve that mission? So I have a town hall with all of my staff every other month. And the last thing we do in that town hall is cover this. Here is how your job aligns with the organization's mission: compliance to regulatory standards, equipment availability, cost savings, cost avoidance. And you can see them here, the things that are on here. And this is what I cut every other month in my town hall with all my staff. This is what I cover. And that's why I say you can go out to my departments, you can go out to my caregivers, and you can ask them, and they hopefully will know how it aligns. Or you could have one like this, the strategic planning. I guess that could happen. Got a hunch? Maybe not. Who the hell knows? So where to start again? Organization overview. It's simple. It's a two-part strategy. Locate the hills and then head for them. So again, the Intermountain Health vision: be a model health system by providing extraordinary care and superior service at an affordable cost. And that's where I'm saying my vision is not the same as the organization's, but it aligns with the organization. So I say we're going to be instrumental in helping Intermountain achieve its mission by striving to become a model program. And we're going to do that through comprehensive assessments, benchmarks, service delivery metrics. We're going to look at staffing structures, financial and budgeting, continuous improvement. That's our vision and how we align with the organization's vision. So it's not the same vision, but it aligns. And then the core values. The ones in blue, those are Intermountain's core values. We are leaders in clinical excellence. The ones in green are the HTM Department of Clinical Engineering core values. We are leaders in service quality. We believe in what we do. We believe in the mission. So you can see our core values are not identical, but they align. They align with the core values of the organization. So some of the critical elements, again, of the strategic plan, really, define the mission and, look at your organization's mission. What is that mission of the organization, and how does your department align to it? How do you contribute to that mission? So that's when I'm talking about defining that mission, that's when you're going to your staff and saying, here's the organization's mission, that's our mission, and here's how we accomplish it or help the organization accomplish it. And the vision and values, same thing. You've seen the alignment of that. And really, we're using that vision and those values for some of our core decision making, especially in the strategic plan as we look at it. We're using those in the operational plan as well, but we're also really implementing that in our strategic plan too. So identify clear objectives. What's the purpose and the desired outcome? And set SMART goals: specific, measurable, achievable, relevant, and timely. It's interesting as we look at some of these things and we talk about metrics and benchmarking and KPIs and dashboards and things like that. And we'll talk a little bit about that more. But I worked for an organization a while back in the Chicago area, so healthcare system in the Chicago area, and we had an individual from the Joint Commission that had left the Joint Commission and came to one of the hospitals that I was responsible for. And looking in the room, there might be a few. I know Carol knows who it was, but there might be a few others. And I don't know if you've ever heard the name Ode Kyle. Ode Kyle was the previous George Mills. And I went into a safety meeting one time and I came in and it was one of his first ones that he was conducting. And I walked in, and when it got to my part for medical equipment management, I gave him my paperwork that showed my KPIs and how I was meeting my standards. And Ode looked at it and he said, "Are there any actionable items on here?" And I said, "No, that's just showing you that I'm performing within my metrics and standards." And he said, "If that's all you're showing me, send it to me in email because you're wasting my time. I don't need to see that stuff. You put actionable items on this, and that's what you bring to the safety committee meeting, not informational items. That's a waste of my time." And Ode actually changed our safety committee meetings to quarterly. He said, "There's no reason to meet monthly unless we've got really relevant, actionable items." But anyways, that's what we're looking at here. Clear objectives, concise, know where we're at, where we're going, how we're going to get there. Conduct a situation analysis. So perform a SWOT, strengths, weaknesses, opportunities, threats, and also look at what are the current industry trends? What are the market conditions? What's the competition look like? What are they doing? Nothing wrong with seeing what the competition's doing and looking at it and going, you know what, that's really a smart idea, and I'm going to use it. shamelessly borrow, steal. Recognize the strategic priorities. So use that SWOT analysis, look at that information, and use that to set your strategic priorities. And really align those areas with the organizational objectives. So look at what the organization is doing and make sure that what we're setting on those strategic priorities aligns with what they're doing. If you don't, getting support for that from executive leadership is going to be next to impossible. Develop plans and tactics. So define the primary strategies, the specific steps and milestones, and do those milestones, are they set in stone? No, they don't have to be. They can be flexible based upon the situation. You know, how many of us had milestones in 2020 and all of a sudden those things took a back seat and we didn't start to revisit them until 2023 because COVID. So you can be flexible with those and really ensure that you've got the appropriate resources. If you set specific steps, milestones, but you don't have the resources to complete it, that's a problem as well. Key performance indicators, measurable KPIs, they need to be aligned with the organizational goals. I take the board goals from Intermountain Health every year, and I look at those board goals and I say, where in those board goals can I align with them to help achieve those items? What are the risks and what's the mitigation plan to reduce the risk? And then create a process to monitor and report on progress. And that may be, so from an operational planning side, I have dashboards and I automate as many of them as I can on the dashboards. And then each one of my directors has a dashboard. And then each one of my managers has a dashboard because they're responsible for different number of personnel as well as the number of hospitals that they do. And then on top of that, we have a huddle process. So I huddle with my staff twice a week. There are other departments within our organizations that huddle every day. I'm part of the environmental care committee is what I report up through, and we huddle every day from 9:30 to 9:45. Huddles are not problem-solving meetings. They are meetings to bring things up that might need to be escalated. If there's a problem to be solved, it goes offline. So like me, I'll escalate if I've got a CT scanner down in one of my rural hospitals and they're on divert. That's escalation. That goes up the chain of the organization. The CEO knows about it. Now, he's going to ask me to report back on the status of that. And if I'm having trouble getting that system back up, I better have an action plan in place that's going to take care of that. And that's what we do like I said, every day the organization has tiered level huddles. It's tier 1 through tier 7. And I sit on tier 4 and tier 5 huddles that escalations come through. But really in taking a look at that from a KPI standpoint, knowing where we're at, we have huddle boards in our departments, just whiteboards. And we have whiteboards and they're safety, quality, stewardship, engagement. I'm missing a couple others probably, but on that huddle board, we may put what our goals are. We may align or take a look at the strategic plan, and then we'll have the KPIs that are associated with it. And every day, my admin updates those documents that are on that huddle board. When you walk into any of our departments, you can walk in and you can look at that huddle board and they're color coded red, green, and yellow. And you can know where this department is at just by looking at that huddle board. Because if it's in the red, not good. It's in the yellow, need some attention. In the green, we're good to go. So I require that and I shouldn't say require, I expect that my departments, if I walk into a department, I expect that on week 1, they're 25% done with their PMs. On week 2, they're 50%. On week 3, they're 75%. On week 4, they're 100%. And when I walk in the door, when I look at that PM graph, I can look at the color and know whether they're on track or not. So it's basically a scoreboard telling me where they're at. We could do the same thing, and we have done the same thing with strategic plans and items that we identify in the strategic plan. So we do it by shop and individual, because we have a time documentation requirement. We expect them to document 85% of their productive time. Now, what I've told the staff is that the 85% does nothing for me. What is important to me is the information that's behind it. So if they're documenting 85% of their time, and then I look at the information behind it, and I find that I've got a Tech 1 that 30% of his 85% is spent on admin, I've got a problem. And we need to determine where, look at it and see where we're at. So it's, because they right away they want to say, you're expecting me to document 85% of my time. It's Big Brother. Everybody's watching. No, the 85% is important, but it's the information and data behind it that's important. So we do that with the technician. There's nothing like peer pressure when you've got time documentation and you've got your staff up there and they're looking at it and going, ooh, I'm in the red. I don't want to be in the red. I want to be in the green. And yeah, as well as it promotes teamwork. When they're looking at the PM pieces, I may have a tech that's looking at it and going, it's week 2 and I'm 75% of the way done, and my teammate is week 2 and they're only at 25%. I'm going to jump in and help them a little bit, get that number up. Yeah. Yeah, and we'll do that with some projects or something that, so if we get, and if I've got a staff member and we say, you know what, let's involve frontline staff in this project, let's give them these tasks to do, and then they can go in and document where they're at in the task, and it'll be color coded. And when I look at it and I can see it and say, well, it's yellow, and then I can look down at the information associated with it and say, well, it's yellow because they're waiting on me to get them this. And so then I know it's me that's holding them up, not themselves. So yeah, so we do that quite often. The implementation plan, again, we talked about the detailed roadmap, responsibilities, timelines. Really, again, you'll constantly see that determine what is the potential risk, what are the mitigating factors that I can put in place that will lower that risk and allow me to accomplish what I need to. Communication, engagement, and communication. Cannot over communicate. Communicate to the stakeholders to gain understanding and buy-in. You will not get your strategic plan when you lay things out in your strategic plan on where you want to be in 5 years. You will not be able to accomplish that strategic plan with just your own department. You will need outside help, outside influence, and outside support. So when you're running through the process of developing and starting, and you get everything down on paper, then take it to the next level or involve somebody at that point from outside. What do you think? Do you think I can change this or change that? Do we need to refocus here? Do you have information about the organization that may impact my ability to complete these steps? So really having somebody from the outside and really gaining stakeholder ownership and accountability. execute the plan, monitor the progress, adjust where required. Again, a strategic plan. You can adjust based upon the situation and the scenario. Evaluate progress and review outcomes. So conduct routine evaluations, review and refine, really so that you're staying relevant with the organization's goals, objectives, so that because they adjust theirs year to year. So you want to make sure that yours are aligning and continue to be in alignment with theirs. So the elements of a SWOT. So strengths, opportunities, weaknesses, threats. The two on the left side, strengths and opportunities, are internal, and the two on the right are external. And you may look at saying, okay, some of our strengths are the knowledge and expertise that we have in the department. I have tremendous knowledge and expertise in the department. And I've centralized the majority of my service contracts, as well as my metrics that I'm measuring. I can do that from facility to facility, department to department. And then my opportunities, service expansion. I need to expand my service capabilities in the lab, because right now we're not doing a bunch of lab equipment. Actually, I take that back. I always tell people that my staff services 80% of the equipment in the lab, but the 80% they service is only responsible for 20% of the cost. The 20% we don't service is responsible for 80% of the cost. What are our threats? Outsourcing, resistance to change, loss of talent. And I say outsourcing because, you know, we're an in-house program, but if you've got an ISO in there, maybe it's the threat is that they're going that they say we're going to go from an ISO back to in-house. Maybe that's the threat. So maintaining that agreement and relationship. So look at the industry, national market trends. Right to repair is up there. Big topic. Seems like it comes and goes, what, Carol, every 10 years? Local market trends, what's going on within the market, mergers. There's other things that may impact it. We just, in our Colorado, in our Peaks region, we just found out that there was an alliance between two of our competitors. One of them has minimal representation in the state, and one of them that has major representation in the state. The other one's from a different state, but those two have just aligned with certain things that they want to do, and that impacts our organization and our facilities, and it could impact my staff. It could impact where we're going for the future. So competitor and customer analysis, business specific, we're looking at HTM there, and then as an industry, healthcare specific. And I have always said, and I continue to say, that HTM, clinical engineering, biomed, whatever the flavor of the day, we have a significant part in healthcare reform and driving where the healthcare industry goes. We have a significant part in that. Just take right to repair alone. What happens if the manufacturers were to get what they wanted and the only one that could service that equipment is them? What happens with cost? Yeah, and cost is going to go through the roof. And who ends up paying for it in the end? And that's why I always say, when I'm doing contracts and I'm looking at things, when I bring my suppliers to the table, there's a difference between vendors and suppliers. Vendors are no different than people that sell hot dogs and popcorn at ball games. They exist on a transactional only basis. Suppliers are people that work with us, collaborate with us to impact healthcare for the good. So if I bring a supplier in and I beat them up and beat them up and beat them up on price, I may get the best pricing in the state. But guess what happens to Hospital B down the road? They're going to pay for me getting what I want, And then who's going to pay for it in the end? The patient is going to pay for it in the end. So creating a win-win creates a win for healthcare. And I should get off my soapbox on that. And but I really think that we have, for so long, our departments have misrepresented ourselves as the fix it and repair shop located in the basement next to the morgue. We may still be in the basement next to the morgue. We are no longer the fix it and repair shop. You got windows now? Yeah, we used to just frame pictures of the outside and put them up and okay. Yeah, but we have got to consider ourselves part of the solution and a major part of the solution pushing forward with healthcare. And I'll tell you, when you start coming to the table and you force your way to the table to begin with, but as you force your way to the table and you start bringing things forward, especially from a strategic plan standpoint, and you show the organization how you can impact them achieving their mission and their goals and their objectives, when you start bringing that forward, guess what? You have to, you stop, you don't have to force your way to the table anymore. Now they call you. They call you on the phone and say, we've got this issue, how can you help? Anyways, strengths. What makes the team stand out? Where do we need to improve? Where can we grow? Who or what poses a risk to the team? Recognize strategic priorities. It's simple. First, we look at the upside, then we look at the downside, then we look at the upside downside. Understand, recognize the strategic priorities, utilize the SWOT, really ensure that we're capturing areas that are aligned with the organization's objectives, stewardship, cost savings, cost reductions, financial performance. I don't know about you, but I'm always fighting the battle with my finance department on cost savings versus cost avoidance. You know, they always say, I say, well, you know what? We didn't have to buy this part. Or we got it from this source and we saved $5 grand. And they say, well, no, you didn't save $5 grand because that wasn't in your budget. And you paid 5,000 for it, and I don't care that it costs 10. And I always tell them it's still savings, and they're like, it's cost avoidance. And I said, well, then you know what? I'm going to buy the $10,000 part next time, and then the next time after that, I'll buy the $5,000 one. Now I've saved $5 grand. And they're like, no, don't do that. But it's important to me that we've really got to track that and report it, and we do it by department and facility. So I can go, because you know what? This hospital administrator or hospital CEO, he doesn't care what that one does. He cares about his facility because that's where unfortunately, that's where his incentives are based instead of from an enterprise standpoint. So we show them how their staff, their caregivers in their facility are contributing to their getting that bonus. Quality, every organization out there is concerned with quality and concerned with safety. I remember when the Joint Commission came out with zero harm, and a lot of facilities have adopted that, including ours. And I was in a meeting one time and we were talking, and they said we had this many patient injuries, patient falls last year. And based on zero harm and patient safety, we're going to reduce that by 20%. And I said, that doesn't make much sense to me. And they said, what do you mean? I said, well, how many patient falls are acceptable? Our goal should be zero. And they said, well, that's, unattainable. And I said, I don't care that it's unattainable. That should still be the goal. You should put processes and things in place that reduce that, but your ultimate goal is to get to zero. Because you know what, if it's my family that's in there and they're the ones that they're the one that falls and they're the only one that falls, that's important to me. So anyways, anything that we can do to contribute to that as well, safety and quality of the care and treatment that's being done with the patients in our facilities is a big feather in our cap, the organization. And that could be as simple as tying patient monitoring cords up so they're not laying on the floor. So there can be some things like that. We had a hospital bed that the weld broke on one of the areas, and we started taking a look at all of those same manufacturer and model of beds, and you know what? We found 50% of them had welds that had broke on that. And when we put a process in place to rectify that situation, clinical and nursing staff and everybody were fully on board with that. Address the critical issues and or opportunities. I know I'm running low on time. Let's get through, break down the strategic priorities, identify the key stakeholders. And this is important. I think when you identify the key stakeholders, look at the ones that you know, and they fall into their stakeholder engagement. They fall into different areas. You've got those that are aware, those that are supportive, those that are opposed, and those that are unfamiliar that just don't care. So when you're looking at stakeholder engagements, which ones do you want to focus on in support of your strategic plan? You don't want to focus on the ones that are unfamiliar with it because they don't care. Maybe you don't want to focus on the ones that are aware because they're on the fence and they don't know which side they're going to go. You know, those that are opposed, I'm not saying that you can't focus on those, because what you should do is find out, why are they opposed? What is their concern? Where do they stand? How can I help them overcome that? And establish a method for feedback and input. So it could be emails, meetings, reports, collaborative documents. Just make sure that that you provide that avenue. And really the SME, the strategy over here, they talk about the different stakeholders: high interest, low influence; high interest, high influence; low interest, and low interest, high influence. So where would you focus in that quadrant? What stakeholders would you focus on? The high interest and high influence, those are the people that are in your corner. They're going to be the biggest supporters. But you've got somebody with low interest but high influence, those are the people that you need to talk to and say, how do I get you on board? What's it going to take? So evaluate progress, review the outcomes, implement a plan in accordance with timelines, monitor the progress, conduct routine evaluations. Again, it's that you develop that strategic plan, you put it in a binder, you set it on the shelf. Well, I guess now you put it in SharePoint, but for us old people, used to put it in a binder and up on a shelf. But it's not something that you put up there and it's a 3-year strategic plan and we'll revisit it again in 3 years. It's something that you should be looking at on a routine basis, measuring, where am I at? What do I need to improve? Where am I already leading out? How am I performing against those milestones?